Nowadays, only about 1 in 3 people see a dentist a year. So a lot of times when people come visit our practice, they are just like I was at a certain point in my life. They were just responding to something that was bothering them, so they call a dentist and they make an appointment. So in our office, we try to welcome those people with no judgment, and those are the people who typically enter our office, and we understand that they're kind of in an emergency situation. We want to take care of that immediate challenge and then get them into a place where they kind of feel okay. But we don't want to stop there because, as I described earlier, just reacting and fixing things doesn't really ever get anyone to a comfortable place. And if we just work like that, then we're just kind of like mechanics. We're not really working to help someone get to health and supporting them. So what we do then is, from that day of the emergency, and when we get someone okay, then we try to move them to the opportunity to where we get to understand their long-term goals and what they kind of want, whether it be to keep their teeth, to stay healthy, to avoid pain. Maybe they have a ton of anxiety and they simply need someone to tell them it's okay and give them some knowledge, because knowledge eliminates anxiety more than anything. So when someone comes after their emergency visit, we describe what a completely healthy situation for them would look like. And we really try to give them that goal in their terms, so they have something that they can work toward over the years many times. And so for our team, what we do is we actually label the number of people we have in each of these categories. And we feel like our major purpose as a team is to move people from place to place, where we take them to the point where they get an exam, and we move them to the point where we break it into short and long-term goals, and then we get someone stable where they're kind of out of the woods and they don't have any pressing issues. And then in the long term, we do our best to get them back to total stable health. And then we keep them there so they never fall back into the emergency situation.